So Dr. Contandriopoulos is a full professor in nursing, researcher at the Public Health Research Institute at Université de Montréal, co-director of the Knowledge Translation Platform in Quebec's Provincial Nursing Interventions Network. His main area of research are focused on the analysis of health policy-making processes, the use of evidence in decision-making, and the analyses of highly performing models of healthcare delivery. He holds a CIHR chair on health policy and evidence. So without further ado, Dr. Damien.
I'm the guy that was introduced just earlier on. My talk is a bit different in focus. I've been involved in knowledge translation teaching for about 10 years now. When in a conference, the organizer find that their crowd is a bit too cheerful. People have a bit too much of enthusiasm. That's when they call me, and I'm usually here to calm you down. So it's only half of a joke, but my take on knowledge translation is the take of a pessimist overall.
Great way to end a conference.
That's it. But I think if we want to progress, it's to some extent a field where progress has been extremely slow. Honestly, when I've been teaching the same strategies for 10 years, really meaningful evidence showing that we have learned something has been hard to come by. And I think one of the challenges we have is we are overly enthusiastic. And I'll discuss a bit of the why. I think there's a structural reason why knowledge translation field has a tendency to see the world with rosy glasses. So what I offer you here is a little journey without the rosy glasses. The world is maybe not as simple as the fairy tale we like to present. What have we learned? We have learned that, honestly, it's much tougher than what we thought. Knowledge translation, more or less, has 25 years, born in the present form in the 90s, probably in Canada. At the first, when you read the first papers from the Canadian Foundation, for example, people were really optimistic. It's going to change the world. Well, it has proved much tougher than we thought. For this, we are sure. We are also sure that it's a complex, social, human process that we don't control that much. Overall, huge pile of data on the effectiveness of knowledge translation, which ranges to nothing to very little overall. And I think this is a fair summary. So we can achieve some change, usually limited in time and limited in overall scope. And the last thing that we are quite sure of, if you have enough money, like lots of, you can impact change in practice. Take the drug industry, for example. As long as you have really an almost unlimited supply of manpower and money, you can make a difference. So the challenge we have as researchers is that we usually don't have the means of our ambitions. So what we still don't know, and this is probably to give an idea of the scope, the scale of what we don't know, we are not sure about how to call it. Knowledge something, okay? It could be knowledge translation, knowledge transfer, knowledge to action, a mix of those terms, or if you out of Canada, it's probably implementation science or something else. So we are not, after 25 years, we're not exactly sure how to call what we're doing, and we are not exactly sure that it does exist. It might. But for example, I'm a university professor, so in the Faculty of Nursing, we teach future nurses. This is not knowledge translation. Then we ship them out in hospitals, and as soon as they reach the hospital, when we teach them, that's knowledge translation. But it's the same thing. What's the difference between teaching and knowledge translation? When we teach a nurse, that's knowledge translation in a hospital. If you teach to a patient, that's patient education. Well, I leave you at this, but it's not obvious that we are even able to properly define the phenomenon that we are talking about. It has to do with information as a tool to change practice. But beyond this, how to put the boundaries with that other human endeavors that imply information to change practice, hard to say. Then we have those words that we love to use. We have no clue what they mean, but evidence, it's really what we call a weasel world, in the sense that different people use the same term to convey different meanings, and there is absolutely no consensus on evidence and decision maker, really. We don't know how to achieve big effects on the long run with limited resources, and this is, we are not sure about how to change practice. If we're talking about outcomes, like health outcomes, even worse. Okay, so I offer you a little journey around a decision tree. The first question I think we need to ask is whether or not our system are changing over time. We take this for granted, but it's not that obvious. Honestly, there are plenty of theories, especially in political science, that suggest that our system are mostly homeostatic. As soon as you disrupt the system, it will naturally bounce back to its natural state. If you think about policy, well, you could describe the world. There's a book about Alford, about interest groups in the US, written about 50 years ago. You take the book and it's the same groups pushing for the same preferences, using the same strategy in the same system. Not much that have changed. If you take clinical practice, you have a clinician, you do an intervention to change the practice might change a bit, and as soon as you're gone, doop, 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 it will bounce back to its natural state. So are the system really changing? That's the first important question, and some theories, and I'm talking about very serious theories here, suggest that maybe they're not. It's a real practical question for knowledge translation, because how much is changing? Definitely there are things that are changing, but there are things that are obviously not changing. And if you don't understand and define what's changed and what's persistent in the system, you will just have trouble to have the proper action to influence change. And take, for example, that image. It's moving, but it's definitely not changing. In a system that is not changing, what's the role of research and, by extension, knowledge translation? Well, it's mostly like an historian or an astronomer. You describe something, and you can just lament on whether or not you like its state, but you just lament in vain over the lack of change. And as a researcher, I've been doing quite a lot of that kind of research. So knowledge translation, if we want to be effective in doing it, a first step would be to have a real operational, useful way of distinguishing between change and persistence. We cannot do applied research, as knowledge translation is supposed to be, without having a basic understanding of those elements that produce stability and change. But let's pretend, okay, let's pretend that the systems are changing. If they are, or at least if sometimes they do change, then there is the second question. How much of that change someone somewhere controls? And I've put that little graph from Mansberg suggesting that in any kind of change, you have the planned part and you have the emerging part, the portion that no one planned and that just occur because of natural forces, because of collective processes, because of stuff that no one can pretend to control. And if those system changes, if our healthcare system changes, what portion do someone control somewhere? If you say, oh, well, systems are changing to a large extent, but no one plans anything in that process. And you can argue this with quite a striking example. For example, you take our healthcare system. It's primarily driven currently by technology, the industry, public finances, global markets, demographic changes. All those things are profoundly affecting our healthcare systems, but no one controls them. Well, at least no identifiable person you can just try to do a KT initiative with. So, and here again, lots of theory, neo-institutional theory say basically this, that, yeah, there is change, no one controls it. If there's no change, if there's change but no one controls it, then research is like the weatherman. Knowledge translation and researcher are in the position to say, we see the storm coming. We can warn you over the consequences, I'm sorry, but there's nothing you can do about brace yourself. And just, we're in Quebec, we're in the middle of Bill 10, which is exactly the role as a researcher we're stuck with. We can warn the minister, well, this was a bad idea. Well, this is still a bad idea. It is going to make lots of mess. And that's it, like the weatherman. But there's no power involved in research here. But okay, let's try to be more positive and say, okay, system change, it's deliberate, at least to some extent, and it's not specific to a given little, a subsystem that is indeed controllable. It's not because beforehand we could not influence the system. We have always been able to control the system. So system change, we control the change, and we always have been able to control system change. I've struggled quite a bit to find a serious framework, academic, serious conceptual framework that would support this, and I failed. Actually, I don't know of any serious work that would suggest this, for one main reason, which is if this were the case, how do you explain the current state of the healthcare system? I mean, if we were and always have been able to influence the system deliberately through research, how come it's such a mess? How come you can explain that it's dysfunctioning to such a large extent? There need to be other parameters involved here. And so that description of the researcher role, you can find it in I have a younger daughter, 8 years old, and she looks on Netflix cartoons. You can find description of the role of research in such a rational model. And you can find it also in some CIHR slides. But no real world description, hard to find. When we describe the world in such a way, when we participate in that 5 years old cartoon kind of the research that drives policy, and we use those fairy tale words as, evidence-based policy, come on. We are using a discourse and terms and a representation of the world that does not resemble actual practice. We are using this representation of the world which is very different from day-to-day experience. There might be reason there. One is self-serving, and this is important to understand. As a researcher, when you say research is important, research drives change, research can improve the world, you're giving yourself lots of power. You're saying, what I'm doing might change the world. And when you present the world in such a way and you're a researcher, you're like, it's quite self-serving. The second thing is you might want to change the world through your description. So you know the world doesn't look like this, but you say, I'll describe it in this way in order to make this happen. By repeating my description of the world, maybe the world will look like what I would like it to like. This is called a performative discourse. Maybe it is, but if it is a performative discourse, then it is slow acting. It has been a while since we have started describing the world in such a way, and progresses are slow at best. So, but the last possibility is the world changes at least sometimes, and someone can control change at least sometimes, and it's not always like that. So you can have an explanation of how come we're not in paradise yet, because it's not always the case that you can control change and you can change the world. But sometimes it's happening. It's happening in sub-context. You have an opportunity for change, either because there are new and never experienced conditions, either because you are in a very specific system, service ward, one given organization, you just have been given enough resources, you are encountering a few partners, powerful organizations that might support your intervention. So you have, those perfect conditions that make change possible. It's very important to understand that it's not always the case, and this is exceptional. So here the real question is understanding what are those new conditions? What are those conditions that make change possible here and now, and why? And how much of a real opportunity exists? The knowledge translation description of the world fits in this and only this view of the world, where there is that notion of the world changes, someone controls it, and research might have a role in that conversion. Here in researchers are preacher-like. We are advocates for change, and we should be involved in that process. I think that presentation and that decision tree highlights what I find few important points. I think we should not take for granted that we can have an influence. I think this is something we should be assessing on a per cases basis. We should be very careful not investing energy and resources in situations where actual potential for change is very limited. Even when change is possible, knowledge translation is only one influence in very complex system where powers in play and there are lots of possible influence to explain change. We should be able to adapt the best strategy to the context, and all this is very classical. But I would like to present a few things that are currently striking me as important. First is the centrality of politics. In the fairy tale world of knowledge translation, politics do not exist. We all are in relation, close relation and collaboration with a bunch of benevolent decision makers that are oh so powerful and oh so interested in working with us. Honestly, it's not true. The decision maker, by definition, if they have a say in the functioning of the system, will be involved in power play, because there is no policy or almost no policy or change that do not involve winners and losers. And usually losers don't like it that much. They will be involved in trying to make sure that their preferences are taken into account, and this is called politics. You cannot escape politics. And if you try to say knowledge translation has nothing to do with politics, then you're probably just limiting your vision, and you're probably just not being as effective as you could be. You know, even those tools that we take for granted, like systematic reviews, are more and more integrated in power relation and appropriated by groups that use money and power to tweak even the best designed systematic reviews. So there's no portion of what we describe as a knowledge translation that can just be described as distance from politics. Politics are everywhere. And that quote about Homer Simpson, I think it's one of the best quotes about knowledge translation I've ever read. Actually, I stole that picture from Jim Stone from McMaster last week. But that's the position where many decision makers will be in. They understand perfectly your point. You don't even have to synthesize that 3-year research in 6 bullet points, because honestly, they understood what you say. It's not because they don't understand. It's because they just don't want to use that information for plenty of reasons that make lots of sense in their world. And unless you are able to change the world they live in, then you're not going to make your information a valuable tool for change. So politics, knowledge translation, not easy bedfellows, but they are unescapable that those two are going to live together. Boringness, a topic where, as a university professor, I'm highly qualified. We are trained to be the most boring human beings on the planet. And it's not even a joke. We write scientific papers which are the ultimate boring text. In human history, never have humans produced such boring pieces of text. And not only that we do this, but we value it. We aim for journals that only publishes the most boring papers. And by extension, we tend to be slightly boring persons. And there's that notion in the academia that, you know, being dispassionate, describing those probability scores and fantastic methods in a very monotone way is actually a proof that we are doing proper, valid, credible research, which might not be true, but you know, that's the way we are expected to behave. And we're trained to behave in such a way. But being dispassionate is the ultimate method to be a disaster in knowledge translation. It's the worst thing you can do. being boring, dispassionate. There's nothing worse than this. So how do you change from the expected from the academia to how to be effective in practice? It's a real challenge. Maybe the academics are not a good person, then there's not knowledge broker position, and blah, blah, blah. There's plenty of stuff written in this, but it's a real and persisting challenge. About boringness, I don't know how many of you have seen this. There's that physician, James McCormick, who makes parodies of well-known songs, and he used this as a tool to change knowledge in the population about good health behaviors. I think there's just one illustration. It's not everybody should be doing YouTube videos with people dancing. It's just an illustration of trying to attract attention, trying to be different, trying to not to bore to death people. And maybe that guideline of 135 pages of small times 9 characters is not actually the best way to change practice. Which brings the second notion of emotional distance versus, what we'd be doing in KT. And lots of the literature in knowledge translation has the goal of trying to link one given technique with one intrinsic efficacy. So audit and feedback is associated with 0.5% of clinical modification of practice in one given group. Does it make sense? Is really one technique associated with one given level of change? Or is it how you're doing it? And my daughter, the same 8 years old, is playing violin. She's learning. And take violin playing. So for each note, there is one finger position. And you move your hand. And it produces more or less the note you're aiming for. And so that's the technique. And it's awful. I mean, the sound produced by an 8-year-old learning violin, it's really horrible. But when you look, good violin player can make amazing thing with the violin. And basically the technique is the same finger position, same everything. The difference is the skill. And knowledge translation, it's the same thing. Actually, I took audit and feedback from one reason. When you look at the literature, it's the only single one technique in knowledge translation that achieved negative effects. This means that you had two groups, and the one group that received a placebo intervention actually had better clinical practice than the group that received audit and feedback. Yes, it does exist. I can send you the study. And the reason it's probably one technique when a sufficiently ill-equipped and poorly gifted team of people doing audit and feedback can probably achieve a negative impact on practice. Why you see such discrepancy in scores of impact given same techniques? Because sometimes the person doing it is just not doing it right. And how much of it is just applying a technique, those 11 easy steps to knowledge translation, and how much of it is being really good at it? And this prompts for me two questions. Can you do knowledge translation if you're not deeply emotionally involved in what you're trying to advocate? I think not. Which in turn brings the question, should every researcher trying to push every one of his results with everywhere to any possible decision maker? Maybe not. Maybe knowledge translation should be reserved to those situations where you really believe that this needs to change, you are ready to invest yourself, to put your guts on the table. This is going to work much more than when you're just saying, let's look at the schedule of my research project. Oh, we've reached the knowledge translation part, so let's do it. First step was, this is not going to work. Never, ever. Just forget about it. It's better not to do it. And so, but for the researcher, it's interesting as it's not technical, at least not only technical. It's really much about how deeply you feel about making a change in the system. That was it. I'm not sure I've helped that much to improve the audits. I'm really a bit, I think it's time for knowledge translation fields to be more open about what we really think take off the rosy glasses, try to describe the world in a more open way, and try to have collectively that discussion of, what's the current state of affair in knowledge translation? Thanks a lot.